Hi friends, welcome to my channel. This video is about dialysis. आज हम इसमें इंट्रोडक्शन ऑफ डायलिसिस, टाइप ऑफ डायलिसिस, हीमोडायलिसिस, टाइप ऑफ हीमोडायलिसिस, पेरिटोनियल डायलिसिस और टाइप ऑफ पेरिटोनियल डायलिसिस के बारे में पढ़ेंगे। चलो वीडियो को करते हैं स्टार्ट। थैंक यू। Dialysis. Dialysis is a process, or we can say this is a substitute for kidney to remove waste material from blood when kidney stops working properly. Part of dialysis. There are two parts of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis. In hemodialysis, HD waste products and excess fluid are removed from the blood by passing the blood through a special filter or artificial kidney celled a dialyzer aided by dialysis machine. Process of hemodialysis: 4 times a week for 4 hours, 5 times a week for 3 hours, 6 days a week for 8 hours overing. Advantage of hemodialysis: hemodialysis is safe as is performed expert staff and doctor in the hospital. Hemodialysis is more effective treatment less than. There is no need to do hemodialysis daily. Disadvantage of hemodialysis: this facility is not available in every city and village. It is painful to insert fistula needle every time. Hemodialysis requires staff and doctor. Food has to be avoided in hemodialysis. Peritoneal dialysis. In peritoneal dialysis, PD, a shift tube or catheter, is infused through the skin into the abdominal cavity, and dialysis solution is infused into the abdominal cavity to remove waste products and excess fluid from the blood. This is done at home, usually without a machine. Type of peritoneal dialysis. There are three types of peritoneal dialysis: IPD, intermittent peritoneal dialysis; CAPD, continuous ambulatory peritoneal dialysis; CCPD, continuous cycling peritoneal dialysis. Intermittent peritoneal dialysis. Intermittent peritoneal dialysis (IPD) is a valuable and effective dialysis for short-term dialysis. Is hospitalized patient with acute kidney failure in child and during emergency treatment of ESKD. 24-36 hours and about 30 to 40 liters of dialysis solution is used up during the treatment. Continuous ambulatory peritoneal dialysis. The PD catheter is the lifeline of CAPD patient. In CAPD, special fluid dialysate is infused into the abdominal cavity. The CAPD catheter is infused and 10 to 14 days before CAPD start. Continuous cycling peritoneal dialysis. The treatment lasts about 8 to 10 hours, usually at night, which the patient in the morning. The machine is discaption and 2 to 3 liters of PD fluid are used to left in the abdominal cavity.